Yeah, Sakina, can you start?
Yes, we can start.
No. So, hello everyone, and a very warm welcome to the 37th episode of the Unsung Hero series, brought to you by the Optometry Confederation of India. So, I'll be your moderator for today, and this series is dedicated to celebrating and learning from optometrists who are creating real impact in India's underserved and rural communities. So, for this session, we have three inspiring optometrists with us today, each with a unique story. So, first, Mr. Sanjay Kumar. He is the founder and consultant optometrist at Blinks Your Eye Care Eye and Vision Pro in Trivandrum. He has over 5,000 patients experience in the medical retina department at Shankar Nethralaya. He served as the vice principal at the Lotus Institute and is now building his own practice. Welcome to the session, Mr. Sanjay.
Very good afternoon, madam. So it's a wonderful warm welcome. So I'd like to introduce myself. So I'm an enthusiastic optometrist with a passion. So I would like to say a few things. I'm a first graduate in my family, so I don't know what is about the optometry in the early stages. So without knowing any baseline things, I choose optometry. So now I'm here. So I'm so proud about it. And firstly, I joined in the dispensing side only. Then later, I joined fellowship in Shankar Nethralaya. After completing the fellowship, I directly worked there for 3 more years. So totally, I will spend around 4.5 to 5 years in Shankar Nethralaya. Then I got an opportunity in Lotus as a vice principal to serve the and to teach the students to make the optometry become more clear. And now I took a decision that I would because my passion is to serve the people directly, so I directly took my decision to start a startup, and I am now running my own clinic. So this is what my short introduction.
Thank you. Thank you so much, Sanjay. So, let's just
Thank
see the video of your clinic. Sakina,
Yep. Yes, madam,
can we
please.
please see Sanjay's video?
Greetings to the people of Tiruvannamalai. Are you experiencing eye irritation, redness, or eye strain due to prolonged use of digital screens? Or are you facing blurred vision,
Can you please
difficulty
increase the
writing at
volume?
night, sensitivity to bright lights, aging? At Blinks Eye and Vision Pro, we offer comprehensive eye examinations, specialized pediatric eye care, dry eye and computer vision care, myopia control management, vision therapy training, low vision rehabilitation services, accurate cataract detection and evaluation, color vision color blindness testing, glaucoma screening and intraocular pressure assessment, retinal examination, binocular vision assessment, eye disease detection and surgery counseling, quality spectacles and contact lenses. Using advanced diagnostic technology, we are committed to protecting and enhancing your vision. Book your appointment today and take the first step toward clearer vision, guiding you toward better eye health and clear vision. Mr. Sanjay Kumar, consultant optometrist. Protect your eyesight through accurate and comprehensive eye examinations. Contact 936 3779258. Follow our social media pages for more eye care tips, vision health information, and updates. Your trusted partner in vision care, Links Eye and Vision Pro. Thank you.
Thank you, Sakina. So, welcome once again, Mr. Sanjay.
Yes, ma'am.
So, moving on to my second speaker today, Ms. Niboli K. Achumi. She is a consultant optometrist and private practitioner at your eye care clinic and opticals in Zuneboto, Nagaland. She has worked at Center for Sight Delhi and Eden Medical Center, Dimapur, before returning to her hometown to start her own practice. Welcome to the session, Niboli. Very happy to have you.
Oh, very good afternoon. Thank you so much. I'm very glad to be here. Thank you, the team of Optometry Confederation of India, for hosting this inspiring episode. I am very honored and glad to be a part of this platform. I am looking forward to have an interactive session and learn together as we have this session. Thank you.
Thank you, Niboli. Thank you so much. Can we have Niboli's video? Thank you, Sakina, and welcome once again to the session.
Thank you so much, ma'am.
Okay. So moving on to our third speaker, Ms. Kelly B. Rupio. She is an optometrist and private practitioner at North Vision Eye Clinic and Opticals in Kohima, Nagaland. She holds a PGDOVS in binocular vision, orthotics, and neurooptometry from LVPI. She has a special interest in pediatric eye care and vision therapy. Welcome to the session, Kelly B.
Thank you so much, ma'am, for having us here today. It's truly an honor.
Thank you. Sakina, can we see any of these screen video? Thank you, Sakina. So, yeah, I welcome all three of you to the session. And before we begin, just a quick note. Yeah, so I hope my screen is visible. So the views, opinions, and the experiences shared by the speakers during this session are their own and do not necessarily reflect the official policy or the position of OCI. And OCI does not endorse or take responsibility for any products, services, or practices mentioned by the participants. So with that quick disclaimer, let's start this session. Yeah, so let's just dive in. I'd like to start a opening question to all of you so we can go around. So what does a typical day look like in your practice and what keeps you motivated basically? So Sanjay, can we start with you?
So I find there is not such a typical day, but I would like to always do service. If the people, more the people comes, I never felt any tiredness or anything else. So I don't know why there are many ways in the optometry, but in that clinical part is my favorite one. So I would like to see the patient and check their refractions and the conversation I used to build with them that makes me feel I get somewhat satisfaction through that. So I like that. So I am doing this, and there is no typical day in my days.
Okay, yeah. So Niboli?
Okay, thank you. I would say every day is not an identical, but then if I have to describe my typical day in my practice, and I would start with having a comprehensive eye examination for the patients of all ages. Alongside my clinical work, I focus on educating and counseling patients about eye health because I think more patients out here they come with limited awareness of eye health. So I explain to them about their condition, then the treatment options, and also the importance of preventive eye care. And being a private practitioner, I also focus on operational aspects of my clinic. in order to ensuring that my patients have a quality eye care in a very welcoming and professional environment. And yeah, I think that's it. And
Thank
yeah,
you.
what keeps me
Yeah,
motivated? Yeah.
go ahead. Yeah, go ahead.
So if I should say like what keeps me motivated is seeing the good vision itself impact, having a positive impact, good vision in someone's life. As simple as something like having a right prescription can improve child education and also a person's work and condition. Yeah, and then an elderly improving independently. So I think that kind of impact that I'm giving for my community itself is what makes me motivated every single day, I would say.
That's very nice. Can you be?
Being a private practitioner, a typical day in my life is quite varied. So I do comprehensive eye examinations. I prescribe glasses, contact lenses, sometimes do foreign body removal. And I do spend a lot of my time assessing children, like I love working with kids. So I don't just assess like how clearly they're able to see, but if they're able to use their visual system for learning and other activities of their life. And also, what keeps me motivated? I think that would be knowing that vision is really important for most aspects of our life. And I often think like children that come to me, how many years they've spent when they went undetected and uncorrected, and how those difficult, like without them knowing that their difficulties were caused by a visual problem. So being in this field where I'm able to identify those issues and help them improve their quality in life, I think that's really meaningful for me. And also, of course, my patients trusting me when they come back with improvement, that really keeps me motivated to do better. Thank you.
Yeah. So yeah, thank you. Thank you for sharing that. And like let's start with you, Sanjay. So like you've been a vice principal, a clinician, and now an entrepreneur. So that's like a very rare combination, right? So how has your academic leadership experience shaped the way you run your own practice today?
So there I have learned how to build the team and how to make the people, how to make the rapport between the things. So that have helped in this in my own practice also. And my first experience is in the Trinity Optics, which is a dispensing optic clinic. So there I have learned how the independent practitioner clinic is been. So I am following the things which I have followed over there in my past years. So that is the main reason which is helping in lot many of my days in my practice. So I used to check comprehensive examination, which includes uh, my history taking, refraction. So I never use auto-ref in my clinic. So the only time I use the auto-ref is to check the K value, because I don't have any keratometer in my clinic at present. So in future I will upgrade that. So in that time only, if I have any high cylindrical patient, at that time I used to take K in the auto-ref. So that one thing is because the learning retinoscopy is our bread and butter. So it is the one clinical thing we uphold the strong refractive skill which an optometrist should have. So I believe strong in my retinoscopy. So I go with the retinoscope and I give the acceptance, and I used to check a duochrome a JCC to refine the spherical and cylindrical powers. So after that, I used to check color vision and even the Schirmer's test. So whatever the ancillary test which is required for the patient, I used to check. So the entire thing, after checking the entire thing, so we can come to an understanding that this patient is definitely having this type of a problem, so we can give easily the solution. So I believe that is the one thing my academic administration, how the way I used to teach the student, the way I teach the patient here also, so which make them understand easily. So that's it.
And yeah, thank you, Sanjay. Thank you so much for sharing that perspective. So, Niboli, you worked at Center for Sight in Delhi. So that is one of India's, premium eye care chains. And then you returned to set up your own practice. So what was the transition like? And like, what did you carry back from your, tier one city or metro experience that to apply to your practice in your hometown today?
Okay, so I would say working at Center for Sight was a valuable experience because it exposed me to high volume technology driven eye care. Uh, I had the opportunity to observe standard structured patients, advanced diagnostic procedures, and then the importance of maintaining clinical standards. Uh, Returning to Nagaland, particularly in Zuneboto, the transition was both uh, exciting and challenging because because uh, uh, the biggest difference was the accessibility of eye care services here. In metropolitan cities, there the for to take not often neglect that and then affects their daily life. What I brought back from uh, the importance of commenting and educating about the hair has always been to receive daily quality eye care without having to travel long distances. So I think that was the uh, experience that during my working days in Center for Sight that has helped me greatly in my practice now. So I would say that.
Thank you, Niboli, for sharing that. So anyway, like you started with a BSc in botany, before moving to optometry. So that's a very uncommon path. What basically drew you to optometry, and do you feel your science background gives you a different perspective from others?
So I took a slightly unconventional turn route into optometry. I completed my BSc in botany, and during my final year, I spent a lot of time reflecting on my life, like on what I wanted to do with my life long term. So I remember it was during my final year examinations. One afternoon, I sat down with my sister and we started exploring for different career options online. And that was the first time that I came across the word optometry. And the more I learned about it, the more it resonated with me. So during that time, it was really scary for me because I was completing my botany and then I had to start a totally like different career. So, but yeah, I decided to take a leap of faith. And looking back, I'm very grateful. Like, I'm happy that I pursued this career because it has given me a deep source of sense of purpose. And I'm glad I came into optometry.
Thank you so much for sharing. So Sanjay, like at Shankar Italia, you investigated over 5,000 patients in the medical retina department, right? So, like, what are the like top two, three clinical red flags that you learned that you should never ignore? And how do you think that, we can apply that in our daily practice today?
So many patients come with a metamorpsia complaints. So many people will think that whether it is due to the progressive lens or something like bifocal lens, they will confuse. So if we check with arm's length itself, we can conclude something is there in the retina part. So this is the one thing we can usually refer the patient to the retina department. So it is a one clinical sign. and the patient with sudden loss, even it is due to the retina or glaucoma or something beyond any cranial nerve palsy or something. So we need to check that patient, and immediately we need to uh, refer them to the ophthalmologist. Why? Because if it is due to some any aneurysms, so it may lead to even death also if, within the 1 or 2 days. So we should carefully check them and evaluate them. So we need, it is our very responsibility to refer them and get and guide them in a prompt time. So that is the thing I learned from Shankar Nitralaya, and nowadays also I am applying the same things, and many of the peoples don't have the awareness among that. And the very upsetting case is the ROP cases. So many of them don't know whether they have retinopathy of premature or not for their kids. After the days, they completely lost their zones, the aneurysms, and after that, the child become blind for their whole life. So that is the one thing. It makes my heart ache. So the early diagnosis and early treatment, which make them life better, and it helps to restore their vision. So that is the one major thing I used to see in the Shankar Nitrira as a in the retina department.
Thank you, Sanjay, for those, valuable insights. So, Nibuli, just coming back to your, varied experience at different places, how do you think the eye care basically differs across these settings, and how have you adapted your approach, from working in these different cities?
Okay, so I would say each location presented with unique challenges and opportunities. Like in Delhi, I encountered a wide range of cases, including patients who actively sought preventive eye examinations and specialized treatments. But in Dimapur, there were a mix of urban and semi-urban eye care needs, with increasing awareness but a need gap for patient education. In Senegal, one of most noticeable difference is that uh, many patients seek help only when they have symptoms or become severely affected that interferes with their activities. So awareness and then accessibility is a major factor, I would say. Uh, because of this, I had adapted my approach by placing greater emphasis on the education, like patient education and then counseling. I spend time explaining to them about their condition, like I said, in a very simple term, in the very simple languages, without using any medical terms, and encouraging them for regular eye examination and how important it is, building trust, and then yeah. So that's how I approach my thing to the
Thank you.
patient.
Yeah,
Yeah, that's it.
thank
Thank
you,
you.
Nibuli. This basically shows, communication and adaptability is the key.
Yeah.
Yeah. So, Kennedy, you completed, PGDOBS in binocular vision, ortho-optics, and neuro-optometry from LBTA. So, how has that specialized training shaped the kind of care that you're able to offer in Kohima?
So I would not be where I'm today if not for my training in Alvi Prasada Institute. And I'm truly grateful to my mentor, Sir Anthony Cruz, who encouraged me to pursue my fellowship in Alvi Prasad Eye Institute. So, uh, going to LV Prasad, like it has really changed my entire perspective on how I view at eye care. So it is not just about prescribing glasses, but it goes beyond that, like how the eyes and the brain have to work together, and how it impacts a person's day-to-day life. I had many expert mentors over there, but one teacher that really influenced me was Dr. Brain Nandini Sadhana. So she was the person who taught me how to think outside of the box, and also during while checking a patient, how it is very important to actively listen to a patient and understand their condition. So, and yeah, I was also exposed to a lot of pediatric cases, non-strabismic, binocular vision, anomalies, vision therapy, uh, and I'm able to. So with all the training that I've gotten from Health Prasad, I'm able to provide the services back here in Coimbra. Vision therapy being a relatively new topic here in Nagaland, there are not many people who actually no one knows about vision therapy 2 years back when I started my clinic, but now slowly with the awareness and with patients growing in vision therapy, people are coming to know more about it.
That is very nice to hear. And it is also wonderful to see, specialized care reaching smaller cities. So, yeah. Sanjay, going back to your previous, experiences, you were recognized as standout performers 2 years in a row. So, what do you think sets you apart, and how do you bring that same excellence into your clinical practice?
So I believe what set me apart is the consistency and the passion towards the work. So if we love the work, we can able to continue to do that work without any tiredness or and I love that work. I love optometry. I don't know why. Before choosing optometry, I don't know about nothing about the optometry, but after choosing, in basically I love to do service to the peoples, though maybe that made me to do this so, and which makes to get that awards and all. So I'm not working for the awards, but I'm just working for the peoples and the uh, everyone to give the clear vision. So not only giving the vision is not my basic motto, and that giving the vision make them some few changes that make some big impact in their life. So that is what I used to get from the patient. And the excellence, in my opinion, is not online achievement. So I continue to bring the same in every part. So that is what I am following in the blinks with the full compassionate and consistency work, madam. So and I like to continuously learn the things. So I always try to learn the new things with a curiosity. So that makes my day with enthusiastic and very clear with my patients.
Thank you, Sanjay. That's very admirable. And like you said, continuing education is also very important for practitioners as such.
Yes, madam.
So Niboli, yeah. So Niboli, you practice in like a 2-day multi-speciality health camp in Nagaland, right? So what was your biggest takeaway from that experience about the community health in your region?
Okay, so it was just a 2 days experience, but I would say one of my biggest takeaways was realizing how many people still have unmet healthcare needs, particularly in rural and remote areas. Um, the health camp highlighted that many conditions can be managed or prevented if detected early. Yet barriers such as limited awareness, accessibility, and delayed health-seeking behavior often prevent timely intervention, I would say. Uh, from an eye care perspective, I met individuals who had been living with avoidable vision problems for years simply because they think that um, the it is not treatable or simply because they do not know help was available. Um, And then, yeah, experience reinformed my belief that healthcare professionals should just go beyond clinics and then engage in community health outreach programs, screenings, and that's how I think this community health camp help me with these takeaways.
Thank you. Thank you so much, Niboli. Yes. Community outreach truly makes a difference, in especially rural parts like this where access is limited. So
Exactly. Yes.
yeah. Kenny B, you have like we previously discussed that you have special interest in pediatric eye care, vision therapy, etc. My question is like, what motivated that focus, and how do you make these advanced services accessible in like smaller cities where like now Niboli has been explaining that awareness is very limited. So if you can share your views.
So I've always loved being around kids, and I think that I was greatly influenced because of my parents. Because growing up, my parents would love having our cousins' kids at home. So I initially joined pediatrics because I like being around kids. But it was only after I joined pediatrics did I realize the importance of the pediatric population, like how important it is for early intervention, early detection and early intervention. So, yes, in Kohima, awareness is limited. So what I do is I try to take extra time to consult parents and try to spread awareness as much as possible by conducting school screening programs or using social media to spread awareness.
Yeah. Thank you for sharing that, Kenny. So just going back to you, Sanjay, like you started your eye care practice Blinks this year, right? So what gave you the
Yes.
confidence to take that leap? Because you've been working in a tertiary hospital, you have previous experience with academics, etc. So what gave you the confidence to take that leap, and what has been the most unexpected part of the journey so far?
So, being having the year of experience in clinical practicals, education, and leadership, so I believe that give the confidence to start Blinks. So I wanted to bring comprehension the ethical eye care in my hometown. So if I search somewhere, so I don't find any eye care with the ethical practice. So they are serving, but which is not up to the mark. So I find why don't I start my own clinic in my hometown to serve the hometown peoples. So what surprised me was realizing that so the entrepreneurship is not just being a good clinician. So it is what to build trust and educating the community. So that is what I believe, and which creates the moral patient experiences, and which are the ones I feel all are equally important. So the most rewarding is being seeing the patient and their families place their trust. So they are trusting me. So I in return I am giving the quality eye care and I am fulfilling their trust. So that is what I am doing in my Blitz.
Thank you, Sanjay. Very nice to hear that. So, Nimboli, like in coming to your scenario, in smaller towns like Zuniboto, awareness about high health can be low, like you also have said it. So, can I know that specifically how do you educate your patients and build trust? Especially, there are many services they are not familiar with. Correct. So, how do you do that?
Okay. So I believe education and trust go hand in hand. So whenever possible, like I've already said, I explain eye condition using simple and understandable languages. I take my time. I make them understand the condition, how treatment can be made, and how if special needs or reference need to be made, I do that. Timely intervention is very important. I encourage the patients to ask question if they want to know anything. I encourage them to ask whatever they have it in mind, and then I also involve the family in discussions if they are willing. And yeah, I think that's the that's how I am educating patient as of now in my clinic. And then what I can do, more patients come to us through word-to-word recommendations. So uh, it is important to maintain genuine and transparency while maintaining and treating the patients. And so, yeah, my aim is to just not only treat the patients, but educate them about the eye health. Thank you.
Thank you so much, Nicole, for sharing that. So, can he be coming to you? Like you also conducted vision screening programs, right? So, what have you observed about children's eye health in Nagaland specifically, and what more you think have to be done?
So from the school eye screening that I've conducted, I'm seeing that there are lots of kids who are wearing glasses now. So I think that is a good sign that awareness is spreading. But I also see a lot of kids with uncorrected refractive errors, especially amblyopia. So my thought process is this: with myopia, kids are not able to see the blackboard. So there is definitely a problem. Parents will go forward and for an eye checkup and get it corrected with glasses. But with amblyopia, what happens is that they're only seeing with one eye, and one eye has lower vision, especially anisometric amblyopia. And maybe it's the lack of awareness that it needs to be treated and it needs attention, because in Kohima, school screenings are becoming regular. Different organizations, different private practitioners are going for school eye screening. But if there is regular eye screening, why are these kids still not corrected? So it makes me wonder. So could be that the parents think the child is not struggling with anything functionally, like they're still able to see the blackboard. So that would be the gap. I do feel that along with school eye screening being conducted regularly, there also needs to be awareness about amblyopia and how it is affecting their vision, and how it needs to be corrected. So after vision screenings, we need to ensure that they actually go for comprehensive eye examinations. Parents especially needs to be educated about all these conditions. I think that would fill the gap.
Thank you so much. That is definitely, a critical point that needs to be considered. Yeah. So just again going around to all of you with few common questions. So Sanjay, I'll start with you. Can you share a specific patient story that remind you why you choose optometry basically?
So for choosing optometry, I myself a example. So I used to wear glasses in my younger age. So I don't like to wear glasses, and I don't know, and any of my family members don't have any refractive error, and I have some curiosity why I got eye power and why I am wearing glasses. So that makes the curiosity to search around the eye related things. So that connected this with the optometry. And before choosing an optometry, I have seen awareness video about the eye. So it is connecting till now in my life. So that is the one thing which inspired me to join in the optometry. But after joining optometry, I have lot of stories. But the usual thing I used to do is many of the elder peoples don't have any company or any attender to take care of them. So in such cases, I used to put leave on that day, and I used to be the attender for them. So that makes them feeling comfortable, and that is also making me happy. So I used to do that thing. So creating some changes in someone's life is creating a huge happiness for in our life. So it is like a drug. So I am doing that. So I love the drug.
Thank you, Sanjay. That is really moving and nice. So Niboli, can you share your story, like from Sunibato's life you've changed?
All right, ma'am. Okay. Among many other cases, I recall one case, a 13-year-old boy. No, I mean, he was a 10-year-old, now he's 13. So he came to me with his mom. He had a condition of headache and then vision problem. But then after so much of correction, even spectacle corrections, nothing improved, it seems. And he sought uh, treatment outside Nagaland as well. But with of no help, he came to me and then explained, his mom explained his condition to me. And then it was, he had an astigmatism, just mild astigmatism with convergence insufficiency. So with corrective glasses and then exercise given to him, uh, his condition improved. And then to this day, his mom still thanks me, and uh, like he is doing academically doing so well. So that kind of impact I put on patients is keeps me motivated all the time. Yeah.
Thank you, Niboli. Thank you. Yes. So those are the small things that we do that really changes somebody's life. Thank you for sharing that. Can you your patient story?
I there's one case that I keep coming back to. It was last year. So a 26-year-old female, she came with complaints of blurred of vision for a year. And when she came inside my room, I saw her facial expression, like she was looking really, she was feeling very low. So she came and with the complaints of blurred vision for a year, and then she told me that she had been previously seen by an eye doctor, like for the same condition, but because she was too young, she was to have any complaints for there. She was told that she should just try harder and look at the uh, books, then she will be able to see. So she was really discouraged. On examination, history taking, her family members told me that she had a rare condition where doctors were not able to find out what was going on with her. She was under a lot of steroids medication. So on Stitlam, I found out that she had a posterior subcapsular cataract and consult her for cataract surgery. But because she has been in and out of hospital and under treatment for a long time, her parents did not want to undergo surgery right away. They just wanted some non-surgical intervention. And also Christmas was just around the corner. So she's a choir director. She had to conduct the choir, and music being her source of happiness, she was not able to see the music scores. So she was at a point of time where she was feeling very discouraged. So I sat down with her and then I told her, don't worry, you don't have to go through the surgery right now if you don't want to. There are other options available which can help you see better. So because she has minus 5 with -2 cylindrical power, I told her that contact lens will really help her see things clearer. And also we can go for progressive lenses, spectacles if she wants to. So on the day of fitting, she came and I fitted the contact lens. The moment I fitted her contact lens, her facial expression is something I will never forget in life. Her face just lit up, her spark came back, and she was looking around the room. She was smiling. She went out to the waiting area. She went outside to look at things, and she came back, she was smiling and she was thanking me. Then I fitted on her on progressive and she was able to see the near vision chart. So she was really happy. We gave her two progressives, one with the spectacle correction and one with contact lens and just the add power. So a few days back, her parents called and they were thanking me that at the time when she was feeling very hopeless, I was able to give her some kind of hope. So that is one case that I would come back now and again.
Thank you so much for sharing that. You know, that's the kind of impact it always stays with. Thank you for sharing that with us, Kino. So just as we wrap up, you know, I'd like to ask a couple of questions to all of you. And how do you see, you know, eye care evolving in smaller cities? Like, let's look at the next 5 years. How do you see it evolving in the smaller cities like yours? Sanjay, if you can start.
Yes, ma'am. So I see in small cities and small towns, many of the eye care is little booming now, and I would say after 5 years and with the digital medium and everywhere, so the awareness is reaching everyone through their mobile and social media. So I find after the 5 years, everybody knows about the eye and eye related things very easily. So that creates awareness and make them more aware about the eye diseases and when to take action and what is the which doctor we need to see and which person we need to go and see for this condition, these signs and these symptoms. So that is the thing I believe which will make in the next 5 years. So I believe in next 5 years the entire eye care will become more precise and more clear towards the people.
Thank you. Thank you, Sanjay. Neboli?
Okay, so I believe IQ in small cities will improve significantly over the next 5 years, especially in terms of awareness and accessibility. Yeah. More people are beginning to understand that eye examination are not just about getting spectacles. It's about like protecting vision and detecting uh, eye diseases early. So I also see advanced diagnostic technologies becoming available outside. Major cities allowing patients to receive quality eye care closer to home instead of traveling long distances. So, but again, however, technologies is not only the enough. So education is also very important. So as optometrists, we should always like how what I'm doing now, we should always educate people about continue educating the communities and the importance of a regular eye checkup and children managing child's eye health, myopia management, and early detection of conditions like glaucoma, um, diabetic eye diseases, and many more.
Thank you, Riboli. Anyway, your points.
I'm hoping there will be more eye care centers in Nagaland and also greater awareness so that people can assess better quality in the eye care systems.
So yeah, thank you all for sharing that. And finally, like we have a lot of young optometrists watching us today. So what's that one piece of advice you'd give them? Sanjay?
So I would like to tell the younger generation is first they should have some patience to understand the patient's complaint and understand their what they are facing and how they are becoming the symptoms is affected their day-to-day life. So that one calmness and patience towards the even in the history taking itself gives some clue. So that clue helps us. And the one thing many of them will miss at the time of calling the patient name, many of them forget to check whether how they are walking inside the room and how they come and whether they are looking or using some canes or somewhere they are they are looking somewhat uncomfortable in the walking, and so that's small signs also which will help they are having some vision problems. So finding and getting that small thing will make the patient and the condition the diagnosis very helpful in the clinics everywhere it will help. So even if they have any small doubts, so they don't forget to do the ancillary test. So they don't need to feel whether it's additional test and there is no need of the test. If you have any query, directly do the test whether it is useful or not useful. We can able to do the data and even we can use it for research purpose also in the future. So no test is useless. So if we are doing some one or two extra tests, now it won't never be the useless one. So it is very useful one. And nowadays people are the younger generations are losing some kindness. So I have seen some younger generations, they are losing some kindness. So they should be kind towards the patient and everybody else because they are also the members of our family members persons. So they are also their good souls, they are also a person like a person in our family. So we need to treat them equally without uh, any discriminations.
Thank you, Sanjay, for sharing that. It's very important. Niboli, yours.
Yes. Okay, so my advice to young optometrists is to never stop learning and remember why you chose this profession. Technology will continue to evolve, but compassion, integrity, and good clinical judgment will always remain foundation of the eye care. Take time to listen to your patients. Be thorough with your in every examination. Uh, don't be afraid of asking questions or learn from experienced colleagues. Mm, every patient is an opportunity to grow, right? So remember, you're not just prescribing spectacles. You have the privilege of preserving sight and improving someone's quality of life. So take the responsibility with dedication and humility. That would be my one advice to the younger optometrists.
Thank you, Niboli. Anyway,
I would like to encourage the young optometrists by saying that things may seem unclear in the beginning, but you will learn as you go forward. So don't be too hard on yourself, and go for the field that excites you. It can be low vision, it can be myopia control, it can be pediatrics, vision therapy. So and also keep learning. Never ever stop learning. The more you learn, the better you'll be able to provide good services to your patients. And always focus on quality, because at the end of the day, people will come to you because of your work. And finally, I just want to say that you're all in this field where you're able to change someone's quality of life. So don't ever take that for granted. Thank you.
Thank you so much for sharing that, Kenny. So, as we are closing, thank you so much, Sanjay, Nibodi, Kenny B, for sharing your time, your stories, and your insights with us today. Your journeys remind us of the incredible work optometrists are doing across India and very often far from the spotlight. So, thank you so much once again. And just before we sign off, yeah. So I hope my screen is visible. Yeah. So just before we sign off, I'd like to thank our official media partner for the Unsung Hero series, Optician India. They are generously providing all our panelists with the Prodigy sunglasses and a 1-year free subscription to their magazine. Thank you for your support to the optometry community. Thank you, Optician India. And to our audience, thank you so much for joining and stay tuned for more inspiring stories from the Unsung Hero series. Take care and keep making a difference. Thank you. Have a great day.
Thank you. Thank you,
Thank you.
madam.
Thank you.